So many pain patients feel so terrible in their skin all the time that they can be extremely nihilistic about making behavior changes. And we really do wrestle with trying to move those patients from point A to point B. It's interesting when we really talk about viewing ourselves not just as treating symptoms or even treating diseases or syndromes, but we really start to think of ourselves as how do I act as a change agent in the life of my patient? And I wonder, you know, how many people that are doing chronic pain management really think of themselves in exactly that way. And if they don't, I think it's because regardless of your background discipline, even as a psychologist, I didn't come into the field feeling particularly well taught in terms of, you know, in terms of what I knew about how to take a reluctant person and help them make difficult behavioral changes. So we wrestle with these patients. We try to think of strategies to treat them that de-emphasize, you know, the pill popping and the medication aspects and open them up to behavior change and other kinds of interventions. But it's really a very difficult situation. You know, if the kinds of changes that we're talking about are be less sedentary, eat a better diet, sleep better, etc., do better self-care and everything. If that's hard for those of us who don't have chronic pain, imagine how difficult it is to start those kinds of things once you do have chronic pain. And I have to say, I've been coming to pain conferences for probably 25 years now. And you know, how to help a pain patient start an exercise program is an infrequent topic at pain conferences, you know. So many of our diseases are diseases of our lifestyle. And so then you have to say to yourself, how do you motivate people to make those kinds of changes? I mean, 21% of the American population smokes, and 2/3 of the chronic pain population smokes. So, you know, how do you help a person who doesn't feel so good in their own skin stop, you know, give up a habit that you know is going to be very difficult to give up and the like? I'm a big fan of William James, who was writing in the 1890s, and in 1895 James wrote The Principles of Psychology. And in one of his chapters on habit formation, he had this really famous quote, which was, "If you want to be a church-going person, go to church." Meaning to say, your self-view comes from your habits, not the other way around. And James actually viewed the brain in sort of 1890s physicalized terms, and he actually saw habits as forming almost like a river running through a valley. And the more the water flowed, the more erosion, the easier, the broader the riverbed, the easier it was for the behavior to, you know, for the river to flow. And likewise, he saw us as laying down habits in that kind of a way. And that so as long as you started a habit and kept at it for a little bit of time, usually somewhere between two weeks and a month, it would then become easy and it would flow on its own, and then you would start to view yourself differently. And I work with my patients that way an awful lot. I'll have them lay out their gym clothes. I've had some patients, of course they're clean, have them go to sleep in their gym clothes so that, you know, they're already ready to, you know, get the behavior flowing in the morning. And I try to break down their resistance in very small, manageable behavioral chunks to move them along. And then finally, and I think this is important but very controversial, and nobody likes when I talk about this, when I talk to my friends in the field. And that is what kind of role models are we for our patients? You know, do we look stressed and irritable? Do we look like we do good stress management? Do we walk into the room with like a little powdered sugar still on our face from the donut we wolfed down for lunch because we didn't leave time to eat well, and so on? Do we smell of tobacco? I mean, some physicians and some of us, you know, some still smoke. Do we look like we exercise? So I heard about a program, and I believe it might be at Duke, but I'm not certain, and it was called something like Healthy Doctors, Healthy Patients. And I think this is actually sort of an ingenious thing where the caregivers take on a behavior change and do it and share their struggles and how they overcome barriers and things like that, and do it alongside their patients. So, you know, they take up an exercise program, they report back, you know, it's almost like you're the patient's buddy in weight loss or smoking cessation or being less sedentary and things like that. And I think while we can't all be normal weight, you know, athletes, programs like that really do talk to the fact that we do have a tremendous influence on our patients as role models.